I'd like to thank you all so very, very much for making this a reality. I know there were so many doubters out there wondering, when is this going to happen, if this is going to happen. Guys, I'm here to tell you this is the real deal. And first and foremost, I can assure you that we are on the campus of United Medical Center, but this is Children's National in your neighborhood. So the same quality, the same services, the same access, we are bringing it here today to this community.
This journey and this rebirth began a couple of years ago with the commitment of the mayor and the council represented here today and the community to offer world-class care. I think in this area is a demonstration of that commitment. I think the walls around you, through those doors and the hallways behind us is our radiology department and our laboratory department, which now offer world-class, state-of-the-art services and care. And throughout this whole entire facility, you will see the demonstration of that commitment to the service to this community. And I want to focus particularly on today and the partnership with Children's National Medical Center. This is just a phenomenal level of service. As the parent of 6 children, I can only share with you the anxiety that a parent has when they have to bring one of their children to the emergency department, not sure what's going to happen, what that outcome will be. This hospital has always been committed to that care, but now through this relationship with Children's National, we will have their levels of expertise available at the fingertips and access in a convenient fashion to our community.
When you look at the quality of this facility here, it is obvious that, one, we have come to the recognition that we have about 40% of the children in the District of Columbia who live on this side of the river, and shouldn't they have access to these kinds of quality medical services right in their own neighborhood? And the same holds true for the UMC, and that is we have the vision, we have the goal, and I've been glad to join with David, join with Marion in moving rapidly towards having the best hospital in the District of Columbia here. This is a phoenix rising out of the ashes, and frankly, much of it is out at this stage. We've got some challenges ahead, but we're going to forthrightly face those challenges because I think every one of us is steadfastly committed to making sure that we have a hospital, a safety net hospital, that is over on this side of the river to serve 140,000 people who live in wards 7 and 8.
I cannot imagine, I'm not a parent, but I could not imagine being in a situation where my child is in a grave condition and there not being a place to take my child. And so what this represents for the 20,000 children that we expect to visit this facility is we expect this to be a place of high quality compassion with world-class treatment, and we know that's what we're going to get.
We see that this emergency department is just one example of how important access to care is. In a medical emergency, we know that seconds, minutes make all the difference. And so by having a hospital here, a pediatric hospital here, emergency department east of the river, means that those children who are here will have this type of access to care when they need it most, close to home. The Department of Health is very proud to partner with Children's National Medical Center to improve and increase access for our children to quality care.
I've not found anybody who's as compassionate and as passionate about health care as David Catania down in the constituency. Let it be known that whatever it is you all think about David and myself, it's not going to get in the way of us making this hospital a 5-star hospital with all the services.
We are so happy as an emergency department at Children's National to be here. We are looking forward to being able to give that world-class care to all the children who live in this neighborhood. It's a pleasure to be here and to be able to provide this care so children don't have to go so far to our main campus. All our physicians who work at the main campus will be here as well to see children, to take care of their needs, to take care of family needs, to really bring that type of care that is so essential. You know, the folks here at United Medical Center have done a great job with the children who they've seen here in the past, and we're just so happy to be here to add to what is already being provided in this facility. And we look forward to being here in the fall. So I have about 15 minutes.
speeches are nice, but Iani and those other two kids who are here remind us why we are here. And that is, as I've said many times, if you are a parent, there is nothing more important to you than being able to take your child to a doctor and to nurses who know what they are doing and who can provide the best medical care for your child. What we hope with this new medical center east of the river here at the United Medical Center is that we are just increasing the number of times that parents are going to have that expression of relief and gratitude and appreciation for great medical work for their children.
I have seen this hospital through some low times and through some high times. And I look around at all of these faces, and this is a high, high moment. We will do everything possible to make this a first-class facility. I give you my word. On behalf of the mayor and the council, we are committed to this hospital. Great day. Thank you for coming. Thank you for supporting the hospital and for the care of the children who will benefit from all of our commitments today. Thank you very much. Thank you.
Okay. You guys help me hold the ribbon. You guys help me. Okay, now you can cut away. Don't cut anybody's fingers. All right.